Our first topic today, doctor, is gynecomastia. Let's first, though, explain to the viewers what is gynecomastia.
Well, technically speaking, gynecomastia, if you break down the word, it basically means female breast. And what it is, it's actually a relatively common incidence. It's basically when a man has some form of a female breast, and it's something that's not talked about very much. If you're on the internet, there aren't a lot of chat rooms, there are not a lot of resources for men. There's more now than there was before, but it's something that I started developing and focusing on in my practice over the last several years, because there is such a need for that kind of procedure and for someone to be an expert in in the techniques to help these men. Especially in Southern California, it's very hard, to not go out with your shirt off or go to the beach or the pool, and a lot of these guys are very self-conscious, and it really does impact their day-to-day lives. So it's one of the most common procedures that I perform, and it is pretty much a subject that a lot of guys are embarrassed to talk about.
Right, and with that said, how does a man actually develop gynecomastia?
Well, it's a great question. It's actually the one thing that I try and answer in all my consultations. What is the cause of that specific person's gynecomastia? And really comes down to one of several things. It's either what's called physiologic, which means that they developed it during puberty, and up to 60% of boys going through puberty get some form of gynecomastia. Now, most of those boys, it goes away after 2 to 3 years, but in a small percentage, it doesn't go away. And that's due to just hormone imbalances that we all experience during puberty. Then there's a more, straightforward reason to get gynecomastia, which is using certain supplements like steroids or testosterone boosters. And those I see a lot, and especially where my practice is here in Los Angeles, with a lot of the bodybuilding community and the fitness community. And then there are other causes as well. There's hereditary causes. There's certain medications that you may not be aware of, certain anti-seizures or antipsychotics, some antidepressants, and heart medications that can cause it. And then there's another form of, not really gynecomastia, but what we call pseudogynecomastia, where just guys who are a little bit overweight and just have a lot of fatty tissue in their breast. That's not true gynecomastia, because it's not the actual breast tissue that's enlarged. It's just they have a lot more fatty tissue in their chest in proportion to the rest of their body.